Okay, I'm going to show you a few ways to work on getting pants on and off using the friction reducing sheets. And granted, these are just ideas and you certainly can change them as you see fit. The first thing we're going to show you is how you might use it if you don't need a ton of assistance, but you are going to cut a 18-inch strip from your friction reducer. And if you don't have the tubular friction reducers, you can cut a strip and then just tie a knot and make this loop. And this works really well. The first thing you'll do, I have a pair of jeans here that we're going to practice with, is you want to make sure that the pants and OTs, you probably do this anyway, so please don't take offense if I'm talking you through this, but PTs, we don't do this very often. So certainly something for us to learn. And you can place that foot in that friction reducer, twist, and set that foot in the pants. And what you'll notice, we'll spread this friction reducer out a little bit. And I can use the pull up. But what's nice about this is that because I've twisted, you can see that the foot piece kind of stays under my foot and allows me to pull that right up. So we're going to go ahead and take this off and do it for the other side. And what's nice is I can pull this out. We're going to try it for that other side. Putting my foot in, and again, modifying this as you need it. Gives me a little pull here. Might be able to pull my foot up. I'm going to twist it so that it comes around. The second pant leg is always the toughest. Pull that friction reducer around. Now I can easily slide my pants on, and you'll have to adapt this for your patient's capabilities. And if I untwist and unhook this, I can either pull it from the top or the bottom. Now, what about getting my pants on the rest of the way? This is where the large piece of friction reducer is nice, and I can bring my pants up as close as I can and shove that friction reducer around the bottom, because that's where we have the most trouble. So even if you just stick it in and kind of put it around your waist, we want to anchor that. And now as I stand up, even if I have one hand, you see that the friction is much, much less as I try to get those pants on. And you'll have to play with this depending on, and same thing with getting pants off. So you can see that friction reducer, even if I have one hand pulling up, I have to work on it a little bit, getting my loops. Yeah, I have to hold on. And then this easily pulls out. Now I can go ahead, grab my jeans. So let's look at that again. I'm going to take these off, stuff this right in my pants, and that's what the helper can do, or the therapist. Shoving that down, making sure. I'd imagine OTs that going down is not as hard, but now getting around my bum, I can easily pull these down. Now I can safely sit, pull that out pretty easily. I can also bring this down through and spread this out as much as I can. And now those pants easily off. That for the other side. It does take some time, but if this is a caregiver job or someone is learning this for the first time and you want them to be successful, now this becomes, or you're using your long-handled reacher, this becomes very, very easy. All right, so once we have our pants on, let's talk about how we might get our shoes on. So the key with the shoes is to make sure that the shoes, if they're tennis shoes like these, I'm going to open that shoe and make it wide. Again, OTs, I'm sorry if you already know this. I'm sure you do. And we're going to flip that over so that gives us a real wide opening. That same 18-inch loop that you made, you're going to take the 18-inch, the smaller width, and push that in the shoe. Okay, and what that's going to do, and then is go all the way into that shoe, kind of the surface, the bottom surface. You're going to spread that friction reducer so that it overlays, and you can kind of see I've creased it, so it overlays the edge of the shoe. Now, your patients can do this cross-legged. Your patients can do this holding on to the friction reducer in the shoe. So I can use that as a loop and I can easily get my foot in there. And now I can pull that friction reducer out. Now the key here is to make sure that when you shove the friction reducer in, that we don't want the loop to get caught on the toes. So that takes some practice to do. So now again, I pull that in, I can hold that friction reducer in place and actually pull my shoe on, or I can do that down here. So that looks like, depending on what your patient's needs are, I can put my foot in there and hold that friction reducer up almost like a shoehorn, and my foot slides in. Again, be careful that when I take this out, if you've done this right, that you haven't got the toes wrapped in the friction reducer, and then that easily pulls out. So just be slow with that particular technique. Another technique you can do with the shoes, especially if your patient needs assist, is when you have this loop, a stool is always helpful. You can put the foot inside that loop, give it a twist, recalling and being careful not to get it too far above the toes. You want so that you can still have your toes. Now I can lift my foot and actually assist my foot, getting that in there. And you can see I can even hold on to this as I slide my foot in there. I'm going to untwist and I'm going to pull that friction reducer out from the back of the heel. Again, being careful not to get the toes caught. And then this simply slides out. Okay. That's another option. If your client can put their foot, and this is how they put their shoes on, then they can do the same thing. They can kind of wrap just to keep it in place. And again, making sure that you have kind of a toe peep here. You can slide that on. You can actually hold the friction reducer in place at the toes and slide that foot right on. You untwist, and remember, we're going to pull this from the back, and then that comes right around. So those are a couple ideas, and I'm sure as you bring your clinical experience to dressing, that you'll find lots of different ways to adapt this. But just wanted to show you that friction reducing sheets really can be used to make things a lot more successful.